Hello guys, my name is Hilda and welcome to Health with Hilda. So in today's video, we're going to be talking about breast cancer. As we all know, we are in Pink October. Yeah, that's why I'm repping pink. We're in Breast Cancer Awareness Month. So it's right for us to educate ourselves on breast cancer, to teach ourselves on how to take care of ourselves so that we do not become prone to this particular cancerous disease. So what do you know about breast cancer? Does breast cancer kill? Can you survive breast cancer? You can leave your answers in the comment section, and please follow up to the end of this video because you're going to learn everything you need to know about breast cancer. So breast cancer comes about as a result of abnormal cells growing in the breast, and these abnormal cells grow uncontrollably. So the uncontrollable growth of abnormal cells in the breast is what we term as breast cancer. And these cells do not only grow around the tissues in the breast, but they can extend to other parts of the body like the lungs, the liver, and even to your brain, causing a lot of damage to your immune system. So 1 in 8 women in a lifetime is at a risk of getting breast cancer, and 1 in 1,000 men. So men are also at a risk of getting breast cancer. So men are not exempted from this breast cancer we're talking about. They shouldn't think that because they do not have any big breasts in front of them, those small breasts they have can actually put them at a risk of getting breast cancer. So what are the types of breast cancer we have? We have 2 main types of breast cancers. And the first one grows in the milk duct. And this type of breast cancer is into 2 parts also. So it's ductal carcinoma in situ. And ductal carcinoma in situ, when it becomes invasive, and that is when we term it as invasive ductal carcinoma in situ, that is IDCIS. And then we have the second one that grows in the lobes. So we term it as lobular carcinoma in situ. Lobular carcinoma in situ is not really a cancer on its own, but its presence indicates that there's going to be a cancer on the way. And when it becomes invasive, that's when it becomes cancerous. We term it as invasive lobular carcinoma in situ. We have other types of breast cancers, like the invasive breast cancer. That is the type of breast cancer that begins to grow in the breast and then extend to other tissues of the body. And we have non-invasive, as the name rightly explains, it does not extend from where it begins to go. Then we have recurrent breast cancer, and recurrent breast cancer is a type of breast cancer that grows after it has been treated. So when you get breast cancer after some months, some weeks, or even some years, then realize that you have gotten breast cancer again. So recurrent, it happens after it has been treated. And then we have metastatic breast cancer. This type of breast cancer is the cancer that extends to other parts of the body. As I stated earlier, that breast cancer can extend out of the tissues of the breast to other parts of the body. So that's what metastatic breast cancer does. It extends to your lungs, to your liver, to your brain, and to your lymph nodes and other parts of the body you can think of. And we're moving on to the symptoms of breast cancer. Some of the symptoms include the growth of lumps in your breast. So when you begin to realize that you have ball-like structures in your breast, so you feel some ball-like things in your breast, please do not hesitate but to move to a healthcare provider in order for them to examine your breast and make sure that you do not have breast cancer. And we have pulling in of the nipples. So when you realize that your nipples begin to pull inward, they begin to pull inside your breast, that should alarm you that you might be developing a breast cancer. And then we have nipples on the breast. So you see some small holes that will go on your breast. They do not really grow, but they begin to show on your breast, like when you have goosebumps, how your body feels like. So they begin to come on your breast. This should signal you that there might be a breast cancer. And we have nipple discharge. So when your nipple begins to have some discharges, whether it's clear or it's bloody, please make sure to go see a healthcare provider because you might actually have breast cancer growing in there. Okay, so what are some of the risk factors for breast cancer? What puts you at a risk of getting breast cancer? What are some of the things that when you do or when they're around you, they can put you at a risk of getting breast cancer? So we talk about things like old age. So your age, so ages, those that are growing old, they are at a very high risk of contracting breast cancer because their cells become weakened and are not able to fight the cells that might come up very well. And we have obesity. So when you're overweight, you put yourself at a risk of getting breast cancer. And we have sedentary lifestyle. So if you're always sitting, do not exercise, you eat, you sleep, you don't even take walks, when the cancer cells begin to grow, they will just grow and grow very well because you don't move, you are just there, you are nourishing them. And we have alcohol too. So alcohol is also a risk factor. And we have being a woman. So the fact that you're a woman puts you at a #1 risk of getting breast cancer. Why? Because you have breast. And breast cancer, as we all know, is abnormal cells growing in breast. So you being a woman puts you at a risk of getting breast cancer. And we also have genetic or hereditary. So if your mom or your dad or your grandmom has ever had breast cancer, that means you're also at a risk of getting breast cancer. So what are some of the preventions for breast cancer? Some of them are keeping away from alcohol. So do not take alcohol and don't smoke, and make sure to eat the right proportions of food so you do not become obese. And some of them are also one of the prevention for breast cancer is avoid taking contraceptive pills after the age of 35, or let's say menopause. Yes, so contraceptive pills or those hormone pills and hormones, medications and stuff, avoid taking them because they can put you at a very high risk of getting breast cancer. And we are moving on to the treatments for breast cancer. What are some of the treatments we have for breast cancer? We have one of the treatments are surgery. So when you have breast cancer, these cells begin to grow in your breast. They can perform a surgery to remove these cancerous cells. And we have radiation therapy. So radiation therapy is where radiation energy is used to kill the cancer cells, let's say during or after surgery. So this is usually recommended after surgery or during chemotherapy. And we have another treatment that's chemotherapy. So chemotherapy is using drugs too. And these drugs are either used as an IV or as a pill. And the drugs are used to either make the cells become redundant so they can remove them, that's before surgery, and you can either use them after surgery to kill cells that were not able to be removed. So small cells that were beginning to grow that were not able to be removed during surgery, chemotherapy can help to kill them. And we have hormone therapy. So hormone therapy is where hormonal medications are given to you. So these medications are meant to make your body produce hormones that will prevent these cancerous cells from coming back again after they have been treated. Like we said earlier about recurrent breast cancer that can come back after it has been treated. So hormone therapy is used to make sure that the cells are dead and dead for good and they do not come back again. So your body produces these hormones to be able to fight against them, that's if they begin to show up. And then we have targeted therapy. So as the name rightly defines it, targeted. So that means we target specific cells. So drugs are given out to target the cancerous cells. And these drugs do not affect normal cells. They affect only abnormal cells. Yes. So those are a list of treatments that can be used to treat breast cancer. And please, this is the end of the video. And I encourage all of us to go to the nearest health clinic to get ourselves screened if you can't do it on your own, like they taught us in schools. And they keep teaching us, because we're in Pink October, there are several healthcare providers everywhere. So you can go anywhere, meet a healthcare provider, so they'll help you to screen and make sure that you do not have any abnormal cells growing in your breast area. And you can also go for the mammogram. Yes, so you can go and use the x-ray to check whether you have cells growing in there or not. And this is the end of the video. Please do well to subscribe to this channel and click on the bell notification button so that when I post new videos, you'll be one of the first to be alerted. I hope you learned a lot from this video. I did learn a lot making this video. Thank you very much. Bye.